760. Our conversation this morning with Dr. Fahmi Farah is brought to you by Marcus and Mack, a law firm representing injured people. A new study coming out of the United Kingdom says that 1 out of 8 recovered COVID-19 patients are dying now from illness complications within 5 months of their recovery. And Dr. Farah is with us, and that obviously is quite an alarming number. Dr. Farah, good morning.
Good morning. How are you?
I'm wonderful, and it's good to have you with us here today. I know that when you have something such as this, and it's been a long, long time since there's been anything on a scale with this pandemic, that there are going to be a lot of lessons to be learned, and not just in the short term. There are some long-term studies that are going to have to be undertaken. This appears to be one of the first that is taking a look at COVID-19 patients who have been termed recovered, but then are passing away from complications. And as you read these statistics and you find out about this, really opens a few eyes, doesn't it?
Oh, absolutely, yes. It's enormous, the effects, the long-term effects that we can expect to see over the course of, I don't know how many years it'll take. But yes, we're seeing lots of complications in all age groups, including young people.
Now, this was a study, a very extensive one, 47,780 people who were discharged from the hospital. And I know that there will be a lot of analysis breaking down those numbers. But in a general sense, are these people that had those pre-existing conditions that we've known about that can be real causes of morbidity having to deal with COVID-19, or are these complications brought on specifically by the virus?
In many parts, it is specifically by the virus itself. But yes, a majority of the people were in the high-risk category. Majority of the people were over the age of 65.
All right. So that being the case, and obviously as the studies will go on and we'll begin to learn about them, it really does sort of tell us that we need to be having a better grip on our health heading into an illness, because that obviously is going to mitigate the effects of that illness, does it not?
Oh, yes. Especially the long-term effects, how well your body can fight the virus. You really do need to be in your best health by minimizing risk factors, maintaining a good immune health by eating healthy, exercising. All of those become very important. Seeing your doctor on a regular basis for those who already have pre-existing conditions like heart disease and, risk factors like high blood pressure, diabetes, they really need to keep those under check by regularly visiting their doctors and taking medications and following all the recommendations.
A few months ago, I asked the world-renowned pathologist, Dr. Cyril Wecht, exactly what does the virus do to your body? What is happening inside your body medically? And he filled us in on how the COVID-19 actually attacks your body. What do we know about the damage that COVID-19 is doing?
The damage is pretty extensive. It can be. In the acute setting, it is causing a very serious inflammatory process that becomes quickly overwhelming for the body, especially when it goes to the lungs. It's causing pneumonia, and that's when patients tend to rapidly decline. They can end up on the ventilator, and then, the rest of the organs kind of follow. These patients tend to have multi-organ failure, kidney failure, and it leads to a lot of them are having complications with heart. Actually, they're going into heart failure. And that's when it becomes even more complicated, and the risk of death and long-term complications become even more pronounced. So yes, the implications of the virus on the body is huge. That's in the short-term setting. But a lot of these patients who are recovering are having lingering effects from the virus, like long-term fatigue, disability, debility. All of those things are affecting the body.
There's a surprising percentage of people who had no previous problems with respiratory conditions that now have developed them, and probably long-term. One of the interesting studies I thought that came out last week had to do with what the lungs actually look like after having gone through coronavirus. And one of the conclusions was they're equivalent to somebody who's been a 2-pack-a-day smoker.
That is correct. For people who have COVID pneumonia, and it's causing fluid to build up as well, the inflammatory process, it's causing them to have cough, pretty significant cough, even after they test negative. In other words, they recover from the COVID. The impact on the lungs is huge. They're seeing that a lot of these patients are having what's called pulmonary fibrosis. That's basically scar tissue forming in the lung tissue. And for the most part, in the past, when we see fibrosis, it's not when it leads to fibrosis, it's usually not reversible. So with COVID, it's hard to say whether it will or not in the long term. But yes, the long-term implication of lungs are scary.
Are people saying to themselves, all right, I got through it, I'm out of the hospital now, and I've just got these lingering effects, and therefore they're not going back to the hospital, they're not considering it to be as serious as when they previously had it, or are they generally going back to the hospital?
Currently, we are seeing many patients who have been reinfected, and now they're in the hospital. We are also seeing people who are being reinfected the second time generally tend to be a little bit sicker, is what we're seeing. So, I do think that there is a group of people who were rather asymptomatic or very mildly symptomatic when they got the virus the first time around, and they're taking it a little bit more lightly because they saw how it didn't really affect them that much. But then there are those who are actually having the side effects, having the complications, and then they're coming into the hospital.
You are a cardiologist, Dr. Fahmi Farah, joining us here this morning on Indiana in the Morning. Do you see new protocols being developed for rehabilitation after people are treated for COVID?
I hope so. I do see there are many patients who need long-term rehabilitation to fully recover with physical therapy, occupational therapy. And many of them are receiving that, especially those who are hospitalized. Once they're recovering from the acute illness phase, they're then having to recover from the disability aspect of it, to regain their strength. A lot of them become quite debilitated, and they're not really able to mobilize on their own, far from, what they used to be at baseline. And they need the assistance to fully recover, and rehabilitation is a big part of it.
People who develop heart problems, since you are a cardiologist, I feel I can toss this one out at you. If they are developing heart problems after having had coronavirus, is the damage the same type of damage you see in a heart that has been stressed and damaged in other ways down through the years?
Yes, in many aspects, yes. One of the complications we're seeing related to the heart is heart failure. And typically there are different types of heart failures. One of them is stress-induced heart failure. We're seeing a lot of that as well, stress-induced heart failure in patients who have COVID, either during the acute illness or down the road. So, yes.
My goodness. As I said, there's going to be study after study, and this is going to be over the course of years. And I'm assuming that you're going to be not only very interested, but maybe in participating in some of those studies. It really is a fascinating field, and from an educational standpoint, I'm sure that you and folks in your position, you're really, really avidly interested in watching how this progresses.
Oh, absolutely. I hope there are many more studies, which I'm sure there will be. Those are very much needed. Right now we're just overwhelmed taking care of the acutely ill patients in the hospital, but we are, soon to be seeing a large number of patients in the long run who will need that help with chronic condition as a result of COVID. So we definitely need those studies to guide us in terms of how to treat and manage these patients in the long term.
I'm going to let you go in just a second, but one of the questions that I wanted to ask you, and be sure I did before we said goodbye, was for folks who put off their health care screenings or getting things taken care of that normally they would have taken care of because of the pandemic. Would I be correct in assuming that they are even more at risk?
They can be more at risk in terms of if they do end up getting the virus, how well they'll be able to, their body will be equipped to fight the virus. So that's why it's so important to not put it off and be at your optimal health so that even if you do get the virus, you're equipped to fight it.
Absolutely. All right, Dr. Farah, thank you so much for being with us this morning. I appreciate it.
Oh, no problem. Thank you for having me.
Have a great day.
Thanks, you too.
It is the voice of Indiana County, WCCS, 101.1 FM and AM 1170 and AM